I'm talking about Cognitive Rehabilitation 101, executive functioning today. Your patient has executive functioning problems if they have the following: not thinking before acting, has difficulty adjusting to changing plans, cannot resist distractions, has trouble concentrating on tasks. And these are not all-inclusive, so there are probably other characteristics as well, but these are the main ones that I would indicate would be indicative of an executive functioning problem. Core elements of executive functioning are self-control, working memory, and flexibility in thinking. Working memory is holding information in the mind and manipulating it. The dorsolateral prefrontal cortex is involved in problems in working memory. Ability to hold information in the mind impacts inhibitory control and ultimately decision making. Working memory declines with age, making older adults more prone to problems with distractions. Self-control involves selective attention, which is focusing for a long period of time on something in particular. Also, cognitive inhibition, which is tuning out irrelevant stimuli. So self-control, those two areas are a problem with the area of executive functioning. Seeing things from a different point of view can become more difficult with aging. That's cognitive flexibility, again, one of the core elements of executive functioning. Therapy helps executive functioning. Training is an active process and is required to help executive functioning. It can impact selective attention and cognitive inhibition, working memory, and cognitive flexibility. The therapy process demands certain elements, such as the patient must be promoted to move beyond their comfort zone. Also, repeated practice is important, and computer programs do show gains. Also, demands must be increased as therapy gains are attained. Executive functioning can be improved at any age. CogMed computerized training is a program that has been found to be effective in this area. Computerized interactive games as well, task switching computerized training, and promoting alternative training strategies. Benefits to improved executive functioning include mental and physical health, success in life, social, psychological development, and faster processing speed. Assessment process would include identifying areas of deficits such as planning and organizing, working memory, initiation, task monitoring, inhibition, emotional control, and shifting, also known as set shifting. So it'd be important to identify which area of deficit is going on with your patient to determine what needs to be addressed in terms of therapy goals and interventions. Interventions would include or can include problem-solving training, for example, go, plan, do, strategic memory and reasoning training, examining possible courses of action from two or more perspectives, and scanning the environment for cues to appropriateness of action. Some external interventions would be posting a reminder to do your goal, plan, do review. That's also known as goal, plan, do. Also, post reminders or use alarms that mean pause and review. How am I doing? Place monitoring reminders on index cards that say, how am I doing, and place them strategically around the home. Review, how am I doing at the end of the day? So take some time out to review the activities that went on and if they actually met the goals of the day. Problem-solving training, an example of that I mentioned earlier was goal, plan, do. that would evaluate a plan that a patient would make, or that you as a therapist would make with a patient. The questions that would be asked are, what is the goal? What is the obstacle? What is the plan? For example, the steps and what materials are needed. What do you predict will happen? What do you choose to do if problems arise? Self-evaluate how you did and determine what worked well, what didn't work, what would you do differently next time. And again, that is what the patient is. Those are the patient's answers. The patient is answering that, but you as the therapist, you are facilitating the patient's development of working through that process. Also, there's strategic memory and reasoning training that involves filter, integration, focus, chunk, link, intervention, zoom, generalize. Tips to treatment would be using a problem-solving checklist to identify a hierarchy of the problem areas the patient is experiencing, using a team approach to identifying the top 3 problems, meaning the family, perhaps, that the patient is living with, or any other friends or anyone else who the patient is involved with on a daily basis and who would perhaps be coming to therapy or providing information to you about the patient. Also, obtaining informant data to confirm patient complaints. Focus on the problem that will be the quickest to remediate, just to get patient buy-in. Sometimes that is very helpful in letting the patient know what they can achieve, that therapy can be helpful early on. And then obtaining patient buy-in. That way, the therapy plan could be, I find that therapy is most effective when patients agree right in the beginning that they think this is something important to work on. Thank you for joining me today. Please feel free to make any comments about anything that I've offered here, and share any information that you may have about additional therapies that you could be doing in this area. And please subscribe to my channel if you'd like further information about executive functioning, memory, attention, language, and also visuospatial skills, which is coming up next week. Thank you very much. Have a great day.